I think, and then we will unmute for the second part, and if that's okay. Obviously, if you don't want to be recorded, stay muted.
Time now is 10 o'clock, Sarah, if you wanted to start, and then I can
Okay.
let anybody in as and when they come in.
Okay, so how many are we?
Oh, I'm just letting Nadia in. I don't know if you want to just give everybody maybe
Oh,
1
yeah.
minute or so, because they might log on at 10 o'clock. I think, obviously. So we've got, so Nadia is just joining us. She's
Morning,
just joining to
Nadia.
audio. She's just joining to audio at the second. She'll be with us in, she should be connected to audio now for you.
Good morning, Nadia.
Good morning. Oh, can you hear me?
Just about. It's quite muffled.
Is that better at all?
Not really.
Oh, yeah. Okay.
Well, we can
We
hear
can
you,
hear
just very
you. It's just-
quiet.
Okay.
You'll have to shout.
All right then. Hold on. I will see if I can. I will see what I can do. I will try and do something.
If you go to your device, so your audio sound settings, there should be a volume for the output.
Okay.
That might help you.
Right, Sarah, it is 10:01 now, and we have Eva,
Okay.
Laura, Nadia, Michelle and Tara. So if you're happy to start, I can then
Okay.
let anybody that joins us in, and I will send them a message just to welcome them on the chat.
Okay, there's only about half of us here, but never mind, but you're all here. So good morning. And thank you very, very much for joining me this morning. And yeah, I've done a few SB Holistic Magic talks before, but this one's a bit different in as much as this is about you guys. So I'm not going to follow a strict presentation. We'll do a little bit of a presentation, but actually I'm more interested in hearing about how you guys might use magic in your practice to help your clients, maybe bounce a few ideas off each other and give you some more ideas also, because some of your clients won't want to come in person because everyone's quite, well, not everyone, but a lot of people are quite COVID cautious. And so this is about helping you to help your clients to use the magic range at home as part of the self-care, which I know most of us are MTI, and MTI is really up on aftercare. That's the Massage Training Institute for anyone who doesn't know that, but I think we all know that. So thank you for giving up an hour on your Friday morning, because you could have done all sorts of things this morning, but you're here. So I was going to start with a bit of a story as to how the magic range came into being, because it occurred to me that I haven't shared that. And then we'll look at a few slides, a little bit of a presentation, and then it's really open to you guys to bring any clinical cases that you have. Is there anything else? And then we'll look at aftercare and some questions. Is there anything else that people would like to get out of the meeting?
Not that I can think of.
For me, it's more sort of also about the properties of the ingredients, and then if
Yeah.
they want to know more about it, that we can tell them about it. That would be good.
Yeah, sure. Eva, have you seen the presentation before?
No, I haven't.
Oh, you haven't? Right. Okay. Yeah. We've got some extra slides that we can do for that, because everything's been chosen for a reason. In case anyone didn't hear, we are recording today, just for a few people that couldn't make it. Okay. So how did SB Holistic Magic come into being in the first place? Well, I trained as a massage therapist with Vicky Gorn and indeed with Eva back in 2012. So it's 2011, 2012. So it's quite funny that Eva, you trained me and now I'm kind of training you. And I'm sure this would count as an hour of CPD. I'm sure it would. And I was already doing some aromatherapy. And after I qualified in the holistic massage, I then went on to do sports and remedial massage, and also with Eva and Julie Linton from Meridian. And as I started to see more clients with injuries, and I went on to do more and more clinical aromatherapy, I started selecting oils for them to help them recover faster. And it was just messing about, really. I had a lot of ladies with arthritis, and there were certain oils that I would use that they'd say, oh, that's like a bit of magic, that. It's got right rid of my pain. I was up in Sheffield then. And that it was the beginnings of what is now the muscle magic. And it's been tweaked and developed. So I started to research the aromatherapy texts as to what oils were recommended for what. And there wasn't a lot of guidance, actually, as to specific injuries beyond things like aches, pains, strains and sprains. You know, and some things were cooling and some things were warming. So I very much started to think about, well, when you've got an acute injury, things are inflamed and they need cooling down, and the lymphatic system needs a bit of stimulation to get rid of excess fluid. Whereas in the more subacute phases and the remodeling phases, we might then need things that reduce pain and bring a bit of warmth, bring a bit of circulation to the area. We might need things that are going to help the tissue to actually heal and remodel as well. So I started to think in terms of remedial. And there are a lot of products out on the market, aromatherapy pre-blends. Most of them, however, are just very kind of straightforward and generic, like warming, cooling, relaxing, energizing, but not very specific as to how to use them. So I was messing about with this stuff. And then in 2014, I went to the Penny Price Aromatherapy Academy in Hinckley to receive my diploma. And Penny started giving a talk about her work and where she was at in her business. And then she said something that made me feel totally outraged. She said, massage without essential oils has no soul. And I thought, well, I know that the people in this room aren't going to agree with that. And I certainly didn't agree with that. And then I thought, how can you say that? And then I thought, well, actually, it depends what kind of massage you're doing. And traditionally in aromatherapy, you learn a routine that focuses more on getting the oils in. It's a superficial, very nice, relaxing massage, but you're not targeting muscles. You're not really targeting all those areas of tension and trigger points and all that kind of stuff. It's more about the oils than about the massage. And I've had those kind of massages, and they're okay, but they don't quite do it for me. But I thought, yeah, okay, Penny, I can see where you're coming from. However, I do think an amazing a muscle massage, a good high-end massage is a great opportunity. If you don't use essential oils, I would say perhaps it's a missed opportunity to get even more goodness into the tissues. Some people don't like it. Some people can't work with oils, and that's totally cool. But I was starting to think, yeah, there's a bit of a gap here in our professions between a good massage with a plain base oil, which, yeah, for me feels a bit like a missed opportunity. Not that it lacks soul, because actually the soul comes in the listening hands of the practitioner and the client who's on the couch as well. And then on the other hand, you get all these amazingly skilled aromatherapists that know what they're doing with their oils, but they haven't really been trained to massage in quite the same way as standalone massage therapists. So how could we bring those two things together? And then Penny started talking more about that they've gone down the product development and white labeling, and that they actually develop and produce skincare products for some of the big brands that sell in places like Harrods, who, I mean, most of them, quite frankly, don't know anything about aromatherapy and essential oils. They just want to sell something that make people look and feel beautiful and make a lot of money for it, which is fine, but they're not experts in aromatherapy. So I thought, what if I could get Penny and her team to make a really simple, easy to use range of products that go a little bit beyond the just warming or cooling, get a little bit more specific in their uses to appeal to massage practitioners. But equally, you don't need to be a qualified aromatherapist to do that. And I know that lots of massage therapists as well would love to use oils, but they're scared, or they find it too complicated, or they're worried about contraindications, like who can use this. So I thought, how about developing a really simple system that would sort that out? You can use these quite safely. They've all been tested, and the concentrations are actually quite low, so they're going to be safe for pretty much anyone who comes into your clinic. And I thought this was a good idea, and so did the Holistic Therapist magazine in 2017. So we developed these and won this award. Can everybody see this trophy? Yeah, are we seeing it, Catherine?
Yep, can see it.
Yeah, we can
Cool.
see it. Yeah.
Holistic Therapist magazine, Star Product 2017. So there we are. That was how the Magic range came into being, and I'm really proud of it. And they're like my babies. These 5 products, they've all got their special things about them. And people ask me, what's my favorite one? It's really about you guys and your stories and the benefits that you've seen. And I know quite a few of you here have seen the benefits. So, Catherine, I think it's a good time to move on to the slides.
Okay, no problem. So we're on the holding page now, Sarah, for you.
Yeah,
On the first slide.
Yeah,
Number 1, yeah.
takes very little. I'm just gonna shut up my screen reader because it's gabbling in my ear and it's distracting. So just okay, I can't shut it up. Right, good-o. You're not hearing Jaws, are you, Catherine?
No, we can't hear it, just you, unfortunately.
Oh no, that's actually fortunate. Great. So yeah, SP Holistic Magic. This is a complete toolkit of 5 aromatherapy products designed for massage and bodywork. And the ingredients have been chosen for their physical effects on the tissues, which I know is what Eva wants to know more about. And they can be used by massage, sports therapists. Also, I've got one physio who uses them. And they could be used by osteos and chiropractors as well. I haven't had as much joy in getting the message across to those practitioners, to be honest. If we move on, Catherine, that'd be great. So this is the terminology, isn't it?
Yes, that's correct.
Great. So this is, you wanted to know about the properties. And so if I were to say something like analgesic, anti-inflammatory, I think you know what that meant. Antispasmodic, reducing spasms. But we've got a few funny words in aromatherapy and herbal medicine that crop up. So I thought I'd introduce these. Antiphlogistic, again, it's kind of another word for anti-inflammatory. Astringent, constricts local tissue such as blood capillaries. So again, that's going to be really important in an anti-inflammatory. Cicatrizant, aiding healing and scar tissue formation. So again, if we're thinking about remodeling and repairing of tissue, that's going to be really important, and laying down of new cells. Ditto, really cytophylactic, which is about aiding the production of new cells, so actually cell regeneration. So we get a lot of cytophylactic and cicatrizant oils going on in skincare products because people want to reduce the appearance of wrinkles and fine lines and all sorts, really, thread veins and anything really, rosacea, things like that. Hemostatic or styptic, something that arrests bleeding. So again, sometimes we know that in an inflammatory response, the body goes a little bit bananas. It's doing a good job, but sometimes it makes too much of a good thing, doesn't it? And you end up with your knee ballooning up or whatever. And that's to keep you safe. But sometimes we just need to rebalance that a little bit. And then the opposite of the astringent really is the rubefacient. So that's something that's going to increase local circulation and heat. And might make the skin a little bit red, bit of erythema going on there. Again, that's much more relevant in later phases of tissue healing. And then we have vulnerary as a very general word, and it just means wound healing. And there are loads of other words as well, like hypotensive, lowers the blood pressure. We talk about nervines, things that are good for the nervous system. We talk about stimulant nervines and sedative nervines. So I know that's a lot of new words perhaps for some of you, but I hope is that all making sense so far in terms of why you might choose an oil for a particular purpose?
Yeah, sounds good.
Cool. Amazing. If we move on then, Catherine, please. To the next slide. Yeah, so this is about safety as well. So SB Holistic Magic is safe for pregnant women and those with epilepsy and high blood pressure. I know people get very worried about epilepsy and essential oils, and most of it is completely unfounded. So who has heard that you can't use rosemary on people with epilepsy? Has anyone heard that one?
Yeah, absolutely. And like really like scaremongering as well.
Yeah, well, there was a study, back in, I can't even remember when it was, where someone fed 15 milliliters, that's a tablespoonful, of rosemary essential oil to a rat, and the rat had a convulsion and keeled over and died. Firstly, I feel really sorry for the rat. Second, that's 1.5 of my small bottles of essential oil. So my little bottles are 10 mils that sit around here. So it's this anthropomorphism and massive sort of extrapolation. So you give a fairly large dose of essential oil internally to a rodent, which is lots more than us, and they keel over and die, have a convulsion, and they conclude from this that you can't use 1 or 2 drops, which is a 20th or a 10th of a milliliter of the same essential oil externally, topically, on a human being. Doesn't make a lot of sense, does it? With the LD50, is everyone familiar with LD50? No. The lethal dose to wipe out 50% of the population. It's a lovely statistic, that, isn't it? But the LD50 for a rat is going to be considerably lower than for a human being. And yet, we do ingest essential oils, those of us that are trained to do so, but we're not even talking about that here. We're talking about putting a drop or 2 in an oil, and the overall concentration of essential oils for massage could be anything up to, you could go to 5%. Some people use neat essential oils. These are 1.6, 1.7%. I think the rules for a pre-blended is no more than 2%. And that's 1.67% in total, not 1.67% rosemary. I think the Muscle Magic has got 0.5% rosemary. So I hope that just helps you guys understand a bit that there's really nothing to worry about. People with asthma, yeah, they are safe, but obviously check individual people triggers and sensitivities. If a client tells you I don't get on with a particular oil, they might be all right with the blend. Just put a little bit on their inside elbow or their inside wrist for them to smell. And you know, if they're worried about it on their skin, they should patch test it for 24 hours. We won't use it this time. We'll keep this on and we'll use it next time you come if you're okay with it, that kind of thing. And children over 6 years. So does anyone massage, apart from their own kids, or perhaps their nieces and nephews, does anyone massage children under the age of 6?
No, I don't.
No. And you don't need any extra training or insurance. So I hope that helps you guys to understand that we are pretty safe here.
Can you just clarify, so with pregnancy, so any of the oils would be all right?
Any of the oils in SB Holistic Magic would be, yeah. I mean, again, in isolation, I wouldn't be using neat sweet birch oil, but the sweet birch oil in your Nerve Magic's 0.2%. So we've worked really hard. So yes, any of the SB Holistic Magic range is fine on pregnant women, yes.
And I've just got another question. So one of the reasons why I stopped using essential oils a little bit and things like that is because of ME. And some people had a really bad reaction. We were just in the waiting area, which is a little bit of essential oils in a thingy, Bobby, what it's called,
A diffuser.
And 2 people had a really strong reaction to that, even though it was only like 2 drops. It's not like we're putting like it was really diluted. So what's your take on that? So because you don't know who's coming in necessarily, or because I work in a practice and I haven't got I don't know all the clients. Obviously I know my clients, but not the ones that other people are seeing, and how they react. So I thought, to be on the safe side, just leave it.
Okay. When you said you were only using 1 or 2 drops of essential oil, was that in a diffuser or was that in an oil blend for a client?
No, that wasn't a diffuser, and
Right.
I don't know to what extent. I think a diffuser, that for some reason that's a bit more powerful, isn't it?
It is, because the 2 main ways that essential oils will get into the body are via the lungs and via the skin. And obviously through the lungs, through inhalation and the sort of diffusion across the capillaries and the alveoli, that massive surface area that we have for exchange of gases. And of course the essential oils in a diffuser are vapor, are in gaseous form. So actually that is going to be that is a much more powerful way than when you use the essential oils on the skin, when in reality it's diluted in a base oil to start with. Some of it's going on you, the therapist, some of it's going on them, the client, some of it's evaporating in the air. So yeah, I wouldn't use them in a diffuser, perhaps, if you've got clients that have strong reaction. Also, which specific oils were you using? Do you remember?
I think at the time was the Niels Yard Organic Defense pre-blend.
I mean, the thing about Niels Yard products as well, I'm not a huge fan, because there are some of their pure essential oils are really good. They've got a lovely Roman chamomile, but all of their blends do seem to have an awful lot of different oils, and this is something I'm coming to. But in fact, if we, to answer the question, we'll move on to the slides in a minute, but actually, yes, if you've got one oil contains many different chemical compounds, sometimes hundreds, and if you combine 3 or 4 oils, you're multiplying that. And Niels Yard Remedies, I think some of their blends have got 7 or 8 oils in, from what I remember. There's just, some of these products have just got far too much going on. And again, with SB Holistic Magic, the maximum number of essential oils in a blend is 4. The maximum concentration is 1.7%. And most of that is going to be going on your skin, on your client's skin, or on your towels, or in the air in such minute doses. So I hope that, does that answer the question, Eva?
Yeah, I mean, yeah, just carry on.
So is there something else?
No. That was just something that I wanted to know, and I'm sure I learned some more. So yeah, just
Great. Okay, so you want to know? Yes, I've got some slides here that go into detail about the different types of compounds and their effect on the body, but it goes into quite a lot of chemistry detail. Do we want that, or do we just want to look at the properties of the individual oils in the product? Do we want to look at the chemistry, folks, or not really?
Not for me necessarily, the chemistry.
Yeah.
All right, that's fine. It can be overwhelming. I think the best way then is to look at the specific oils, Catherine. If we're going to look at the individual products, apart from Eva, does anyone do myofascial release?
No, I don't.
No. No, okay. I haven't put myofascial magic on this presentation, Eva, but I can tell you a little bit about it. Perhaps if you've got a minute to stick around at the end, just so that yeah, we can do it separately, just so that these guys get what's relevant for them as well. So we'll look at the muscle magic, Catherine, if we could, please. I'm looking for this myself.
Hang on. Right, we're on Muscle Magic, first page, Sarah.
Yeah, that's what I'm trying to find. I seem to have a page missing, which is not a good thing. Sorry, folks, I'm having a few issues here with my presentation, which doesn't bode very well, does it? Oh, there we are. Right, Muscle Magic. So, I mean, this is my #1 go-to. This was the first product, really, that was ever sort of used in almost its current form, that I was massaging in the Society for the Blind, in Sheffield Ross Society for the Blind, and there were lots of old ladies that came in with aching backs and arthritic knees, and I just made up a few blends. And this one seemed to appeal because it was very warming. A lot of these women had just lost their sight as well, so there was a lot of stress. So we were dealing with sort of relaxing them on an emotional level as well as a physical one, because obviously we don't really separate these things. And although I'm talking mainly about the physical things today, I'm not in any way downplaying the emotional side of what's going on for people. And actually the oils are going to be super supportive there as well. So we use this one. It's great before exercise. I've got a guy who uses it before he goes running, and he says his hamstrings have stopped hurting, so marvelous. To relieve your general pain and tension. If someone comes in for a massage and they've got a few general aches and pains, and they just need something warming and soothing, then this is what you go for. It improves circulation, and it's got mustard seed in it, so it's quite warming as you work with it, but it's not that real sort of crazy heat from something like Tiger Balm. It's a more gentle, subtle heat that you start to feel in your hands and forearms as you're working with it, and the client feels it. It's quite subtle. I mean, mustard seed on its own is not subtle at all, but in that dilution, it is. So you can use it for conditions that respond well to heat, like osteoarthritis, yeah, and to aid healing in the more subacute and remodeling phases. So if you were starting to tell a client to do ice and heat for something, or more heat, then that's the point when you use it. If you're still having to ice an injury because it's inflamed, you're not using this on it yet, although you might use it above the area. So someone sprained their ankle, you could use the Muscle Magic to massage the quads, for example, or the hamstrings, the buttocks, and sort of promote that local circulation above the area. And you could, of course, use it on the opposite leg that's compensating, or anything else that's compensating. And it's also quite a nice digestive one. So if we look at the next slide on that, this is what's in it, which I know is what people want to know. The rosemary, because it's a lovely analgesic and an anti-inflammatory, an antispasmodic, astringent, cicatrizant. I don't need to read all these out, perhaps, but again, rosemary is great at promoting circulation. And marjoram, which is also great for that, and very relaxing, a good parasympathetic activator there, and reduces the blood pressure. And we can move that one on, actually, Catherine, to #3, please. Black pepper, again, that's very super warming as well, and got that slightly spicy aroma. If you've got your oils there, and I'm aware some people's haven't arrived in the post yet, I'm really sorry. But yeah, have a little sniff of the muscle as we're talking about it. Ply, which is a bit like ginger. It's Zingiber cassamuna, so it's the ginger family. It smells a little bit more citrusy. I sort of think if you combine lemon and ginger, you get something like Ply. And again, it's a lovely analgesic and a local anesthetic as well, and a muscle relaxant. So, and then as a base oil, we've got some special base oils that are warming, the mustard, as mentioned, and sesame. Incidentally, mustard seed is the only carrier oil, base oil, lipid that is an irritant on the skin in its undiluted form. None of the other base oils are like that, but mustard is, because it contains erucic acid, which is the only irritant fatty acid. So there we go. Any questions about muscle magic? Either you've all fallen asleep or you're just so wowed.
No, sorry, no, there's no questions. I was just thinking, but no, there's no questions. Not from me anyway.
Cool. Catherine, how are we doing for time?
It's 10:30, Sarah.
Ah, brill, thanks. Okay, amazing. So if we have a look at nerve magic then, please. I think this is probably my favourite because it was so hard to formulate and it's had such amazing results for people. I've had more reviews on this one than any of them because therapists have used them for their clients with long-term pain, as have I. And they say, oh, it's wonderful, I've tried this, I've tried Forever Living MSM lotion, I've tried this, I've tried that, and nothing's helped them. I think it was quite hard to formulate because the essential oils in it are a bit like 4 shouty, warbling sopranos that you have to keep in check so they don't drown everybody else out in church. So it can be used, for treatment of... I'm sorry?
It's such a good image. Sorry.
It's such a...
It's such a good image.
Yeah. So, yes, 4 oils that love the sound of their own voice in that blend. And it was very difficult to formulate. It took about 3 attempts to get it right. So these are used in the treatment of nerve impingement conditions like sciatica, piriformis syndrome, thoracic outlet, sort of tennis elbow, carpal tunnel, all those kind of stuff. You get the idea. Tissues inflamed, trapping the nerve. Not much fun. Also, if you're looking more at the central nervous system for clients with your fibromyalgia and chronic fatigue, so Eva, you will probably find if you use this for your ME clients, I find most of them just can't get enough of the stuff. They're just, oh yeah, that's quite, oh yeah.
Because it's with essential oils, as people are sort of drawn to the ones that are good for them anyway.
Yeah, totally. Yeah. And after exercising as well, because it's sort of generally a bit sort of warming and cooling at the same time, which makes no sense at all. But it can feel warming and soothing, but it actually has anti-inflammatories in it. If we move the slide on, Catherine, these guys can see what's in it. So yes, this is the secret ingredient. Is Eucalyptus stageriana. And we are not talking the kind of eucalyptus you use when you've got a cold. This is totally different. Chemically, it's more, she's not like anything. It's got such a complex chemical makeup. But it's a lemon-scented eucalyptus. It smells a little bit like sort of sweeties, sort of sherbety. And this is the magic because it's got that wonderful calming and combined effect on the immune system and the nervous system and the muscular system. So that's just going to lend itself. I use it in the winter, boost your immune system and lift your spirits. Can't get enough of it, actually. Corn mint. If you thought peppermint was strong, corn mint's got an even higher menthol content, and it's anesthetic, analgesic, antispasmodic, and specifically neurotonic, anti-neuralgic. Wonderful stuff. If we move on to the next one, Catherine, please. Then we've got Roman chamomile, which is an analgesic, again, an anti-inflammatory, quite a lot of esters going on. Similar thing, really, but more of the anti-inflammatory and kind of the gentleness. And then we've got sweet birch, which is probably the most hazardous essential oil I use on a regular basis. And that's why it's only in at 0.2%. But when I'm making up a blend for a client, you can't, if you're making it up from scratch, you can't really get it in at less than 1%. And yeah, it does actually send me slightly loopy. It's good stuff. It's that real sort of liniment-y smell. Your like wintergreen oil is a similar thing. It's 98% methyl salicylate, so we're talking an aspirin-like, very direct analgesic. So on clients who are screaming in pain with sciatica or something so much that they just the minute you touch them, they are screaming and resisting, and it's a 10 out of 10 and you've just put a hand on them, that's when you get the sweet birch out. It's yeah, it's our army. Wonderful, love it. And then hypericum, macerated, that's an infused oil. So the hypericum has been steeped in warm olive oil to take up the properties of the hypericum. The yield isn't enough to get an essential oil, so we use it as an infused oil. And that again is amazing for nerve repair. You don't need to worry about people being on the pill to use hypericum topically. If some of you have heard, and it's quite true, that you can't give hypericum as a herb to people that are on the contraceptive pill, that's quite true. Systemically. Topically, again, it's 5% macerated hypericum. It's not going to be a problem. Okay. Next one for Scar Magic, please, Catherine. So this is, if you've got it with you, this is a really silky, nourishing massage balm for scars and adhesions, internal and external. I'm using it right now. I've just had a hysterectomy, so I'm using it on my tummy a lot every day. And actually before the operation, and when I went back to my gynecologist and they checked the wound, they could not believe it, how well it had healed. So I actually started using this after 4 weeks of the op. Technically speaking, they say 6, but if it's healing well, I went for 4 weeks and it was absolutely fine. And yes, if you can use it pre-operatively, you're going to repair the site, tonify that fascia, and give the skin the nutrients, so that person's going to be healing way better after the operation. It can be pretty good for, it can't prevent stretch marks, but it can reduce them. That's quite good for pregnant women, even if it does have a bit of a lemon cheesecake smell to it. My pregnant friend used it and her husband complained that she smelled like a lemon cheesecake. It's because it's lemongrass. When else? Post-operatively, we've talked about that. When the stitches have been removed, when the skin's intact, because you don't put oils on things where the skin's not intact, because it can actually soften things and break them open again. So when things are healed enough, then yes, you can. And also for sort of cross fiber friction over, you know, those adhesions, you know, when you're working. Well, anywhere on the body, particularly the back, I'm thinking around the shoulders. Yeah, brilliant. And if people don't like an oil, some people who like waxes more tend to like my Scar Magic. You can get a really deep pressure with it. Actually, you can get a deep pressure with all of them. The consistency is such that if you use it sparingly, I've found that there's enough there. It's not so thin that the client's skin is drinking oil, but it's not so thick that you're sliding all over the place. We seem to have got that consistency bang on there with the different base oils that are in it. So you can do deep massage with all of them. Okay, next one, Catherine, then if we look at what's in it, please. So what's it got in it? Lavender, well, most versatile essential oil on the planet, analgesic and anti-inflammatory, real cytophylactic, cicatrizing. So it's that whole regenerating, healing, remodeling. Ditto a lot of the other oils in it. Lemongrass has been found to actually tighten the elastin fibers in the fascia, so that slightly sort of firming effect. And it's a great analgesic as well. It's got cymene, I think it is. Really good pain reliever as well. And the next one, Catherine, please. And then the same principles we talked about, helichrysum, which is a very interesting oil. If you put a drop of helichrysum on a wound that won't stop bleeding, it will immediately stop bleeding because it contains some lovely little ketones that have that They're anticoagulant internally and coagulant externally, which is really quite cool because you don't want blood clotting inside, but once you've got an open wound, then actually clotting will prevent further bleeding and start that healing process. So that's pretty cool. And frankincense as well. Again, that regenerating effect. And yeah, carrot tissue, rosehip, vitamin A in the carrot, vitamin E in the rosehip, really good for scarring as well. So yeah, that's a good product. Do we have any questions? Actually, I forgot to ask, nerve or scar, before we move on to the next one?
No.
Yep.
Okay, let's rescue then. To the next one. This is not for actually massaging with. This is a cooling cream for early recovery. You might use it if your client has come in with said sprained ankle and they're going to have a massage on other body areas. You could certainly, either or I might do a little bit of fascial compression on that ankle perhaps, and then apply some Rescue Magic, and then use whatever else to massage the other areas of the body that you can treat. But it's lovely to be able to treat even when you can't massage, because of course treatment might be to do nothing. You know, you'd probably give the client an extra pillow to put their sprained ankle up or elevate it a bit. And there's absolutely no harm in putting a bit of Rescue Magic on there at all, as long as the skin isn't broken. It's great after exercise if you suspect injury, or indeed after a vigorous massage if the client's gone very red and you think, uh-oh, they're going to be sore tomorrow. I have one lady who was really quite sore after the first 2 treatments I gave her for several days. So the next treatment, I worked as I had done, and then all over her back with the Rescue Magic, and she was not sore the next day. I think maybe ever so slightly the next day and nothing the following day, but it massively reduced her soreness after treatment. I also used it myself in the pilot phase when I managed to sprain both ankles at once. And I used that, did some fascial compression, did some icing. I did take some homeopathic stuff as well, so we treated it systemically. I was going away for a few days and I thought, oh golly, I'm gonna have to book a wheelchair assistant up on the train. Well, the next day I was hobbling and the following day I was walking almost normally. It took a few more weeks before the pain completely went away, but that was a pretty good recovery. And yeah, there were other things coming into play, but it was look after this as best you can. And Rescue Magic had a hand in that for sure. I developed this actually for but I had a pole dancer client, a professional pole dancer, I would add, who kept finding new ways to hurt herself, and I made her up an oil with a lot of these components in it, and I kind of thought its subtitle should be "Ow shit, that's going to hurt tomorrow," but it became the Rescue Magic. So what's in it? Next slide, Catherine, please. So it's got geranium, which really I think of as the lymphatic component here. But it's got all sorts of amazing properties: circulatory decongestant. And very relaxing and good for the emotional stress of just having hurt yourself as well, which is never fun. And it smells great with the lavender, again, for that healing, the regenerative, the anti-inflammatory. And yeah, next one, please, Catherine. What else? We've got peppermint. It's immediately cooling when you put it on and anesthetizing and getting rid of that pain. And German chamomile, which is just a most wonderful anti-inflammatory. Yeah, brilliant for bruised areas. And the infused oils there are arnica and comfrey. So we don't put this on broken skin because arnica is actually, it's probably no harm at that level, but arnica is actually a toxic oil. Certainly you have to be very careful with it, and the peppermint would irritate. And I only sell these directly to therapists and encourage to use on their clients because actually you do get members of the public having inappropriate requests. So I had somebody wanting to buy my Rescue Magic who had it recommended by their therapist. They weren't a therapist, so I thought I'm going to ring this person up and just make sure that you know what they want to use it for. he wanted to use this Rescue Magic, complete with its peppermint, for a rash on his genitals. And that wouldn't have been very clever. So, you know, I know it can seem a little convoluted that you have to have an account with me to buy this stuff, but we need to keep everyone safe. And often it's the oils that are safe, and it's the people that do stupid things or things because they don't understand. So that is why we have the systems in place. But actually, I would absolutely encourage you to use this stuff on your clients and encourage them to use it at home. You know, if you've got someone very athletic who is always doing themselves a mischief, they can have a bottle of Rescue Magic in their cabinet and treat things even before they happen. If they're having a good session of whatever workout it is, they can use their muscle magic beforehand to prevent injury, hopefully, because if you've got better circulation and the muscles are warmed up, they're less likely to get injured, and then they can have the rescue afterwards if they think they might have done themselves a mischief or they might be sore tomorrow. So, I mean, prevention is always better than cure, right? So, likewise, your scar magic, anyone's having an operation, brilliant. Let them have that stuff at home to use before the operation, to use after the operation. I've just used it on, well, I didn't use it personally, but somebody bought it for their husband who'd had a quintuple heart bypass. The mind boggles. But lots of very unsightly scarring he felt on his legs and on his chest as well. And they've been using it and it's gone right down and now you can barely see it. So he's a happy bunny and it's not restricting his movement anymore. So for those of us that do scar work, which I think would be Eva and me that do scar tissue release, do that work dry, obviously, with the fascial techniques, and then do some nice massage with the scar magic, which will be very welcome because it can be pretty hot and pretty hot and tender after we've done scar release, can't it? So
You see people at all after liposuction and stuff like that?
After a C-section, was that?
No, liposuction.
Oh, if they've healed up, yeah, why not? Why not?
Very small incisions, but obviously it's quite an intervention and a lot of swelling in pockets of.
Yeah, and I think people that have that, you know, will have issues around self-image, and lemongrass is just such an amazingly mentally clarifying oil, and that's the predominant smell in the lavender, so it's going to help them emotionally as well. Do you have lemongrass in there as well? In the rescue, in the scar magic, the scar. I mean, that's the scar. Sorry, we're talking about the scar. Yeah. Okay. So yeah, I mean, really, I'd like to just throw it open now to any questions or any cases, because one of the pieces of feedback I've had repeatedly, Catherine, if you want to stop the screen share, that's cool. Thank you. Yeah, so really, one of the big pieces of feedback I've had is people say, well, I don't know what to use this stuff for. And it kind of does what it says on the tin. But yeah, let's bring this alive for you and, you know, get these for your clients for Christmas presents, because I'm still carrying on the offer for today for you guys. So if you want it for your clients, now you understand more what it does, or you want to start selling it to your clients at a markup, or actually give it as a smelly Christmas present that actually is a lot higher quality than most of the smellies you buy for Christmas, then yeah. What do you got? What do you want to discuss? Any questions? Any cases? Can you just let me know? So for me, so as you know, I bought quite a lot of the nerve. The nerve, you did. Because especially with the lockdown, you've got like, especially in case of sciatica and pinched nerves and the neck really multiplied, and people seem to be getting much more sensitive, so they react much more to the massage. They can't take as much pressure. Everybody's a bit more delicate, and the nerves are basically exposed in every sense. So I thought that would be quite good. But so if we gave our sales to a client or whatever, so how often would you say for them to use it? You can't go wrong with it, really. I mean, I think this is it. I had somebody saying, can you over apply? And the answer is no. I think if someone's got a lot of pain, then they should have a routine, maybe sort of 2-3 times a day of putting it on to kind of keep on top of the pain, which is something I'm really struggling to communicate to a current client of mine who only puts it on when she feels the pain. Yes, put it on initially, and yeah, keep applying it to get that anti-inflammatory, to get the oils into the system. And to be honest, I tend to find with herbal and aromatherapy stuff, when you don't need it anymore, it's a time when you start forgetting to use it, or when it doesn't smell so appealing anymore. And at that point, you know, you think, I just don't need this now. And your body kind of just tells you that as well. It's pretty cool.
That's great. And just another question from me. Sorry.
No problem.
Hijacking this now, but you know, you're all welcome to say something. But so with gloves, just generally with the use of aromatherapy oils, obviously you absorb a lot through your hands. At the moment, we are working with gloves anyway, so that wouldn't be an issue. Would you recommend to normally use gloves anyway, even after the COVID situation or whatever? And is there any effect of the oils on the gloves? I know that latex gloves are not great with essential oils, but is there anything that you have to be aware of?
I'm not so certain about that. I think it will be a case of trying them, because with me being totally blind, I have a very good reason not to use gloves, because I can't function with, apart from for, you know, pterygoids and palatines and things like that, obviously. But other than that, I don't actually use them myself. But I think people are using the nitrile. I think I have heard the nitrile gloves. And of course, they're only a single use. So although they might degrade the nitrile over time in a single use, I don't see that. You're just going to put them in the bin after the session. So, you know, I can't see it's a problem, but it's the thing you're going to have to try, I think.
Yeah. And you don't get any effects, because I mean, what I often wonder about is just like, if you know aromatherapists, and you obviously yourself use aromatherapy oils quite a lot, because you absorb everything. Like you're working with them all day and you absorb it all, or what does it actually do? You know?
Well, interestingly, because I mainly do myofascial release now, I actually tend to use the Magic in my clinic. When I was using a lot of essential oils, like 5 clients a day, 4 different oils per client, I was making afresh as well. So 20 different oils I could be exposed to in a day, theoretically. I had at that point, and it could have been a stress thing that was going on for me, I had really bad discoid eczema on my arms, and yeah, that sheer amount of oil would flare it up. But I found that the Magic oils, again, because they're more dilute than you can actually make up on a small scale for a client, you know, because if you only need sort of 5 or 10 mils of oil for a client, and you want to use 3 different oils, you're going to have a, you know, if you're only making up 5 mils of carrier, you're going to have sort of a minimum of 3% going on, just to get them what they need. So the amount of it, I found that, and now I use the Magic and stuff, my eczema has cleared up, thank goodness. And it might have been just something my body was going through. I think it probably was. And it just cleared. But I find that the Magic range, because it's that bit more dilute, doesn't tend to irritate in the same way. And again, you're only going to be using those products, so in those low dilutions, so you're only likely, I think, to get more pleasant effects. I mean, obviously, if there's a particular product you don't get on with, don't use it. But yeah, I don't think it's the same as a clinical aromatherapist that's pre-blending everything from scratch, which I now only do for clients to take things away and use them at home.
Okay, thank you.
Can I just say, just on a positive note, I've been using the Muscle Magic and the Nerve one on most of my clients for over a year now. And one thing I have found is that it's really nice on their skin. I've had clients that have got eczema or dermatitis, and actually they've come back and said really positive things about the oil. And it's also nice on my skin, because I use my forearms and elbows like most of you will be, and I don't find I have any sensitive reactions. And a lot of people find it quite calming. They like the smell. So it smell a lot of. I work in a clinic on a Tuesday and Saturday in a physio clinic, and a lot of the the physios come in afterwards and or in between into my room in between massages, and they always comment on how nice the room smells, which is quite good. So I thought I'd just comment on that because it's quite nice to have. This is really good information. It's quite informative because there's quite a lot of things I didn't know about what the oils can do. But having used it for over a year, I've had feedback from clients who just really like it. So I do recommend it if people haven't used it and want to just give it a try. And I do wear gloves as well, and I'm finding with gloves I don't have any issues. There's a bit of a trial and error with how much to use on the gloves because you can't really feel it the same. But I'm getting there with that. So just give it a try if you haven't.
Right.
Brilliant. As well, and yeah, thank you for that. And yes, of course, they are skin friendly. So I mean, although I haven't designed them to be specifically good for the skin, they're not sort of for healing the skin, but there will be things in there that are good for the skin. So absolutely, that's great feedback. It's a mixture. The main base, which I never actually said, is a mixture of sunflower oil and really high grade sunflower oil with the vitamin E content, and apricot kernel, which is a little bit richer than almond, but similar kind of properties, but again, skin kind at the very least. Yeah. Sorry, Evie, you were going to say something. I cut you off. Sorry.
Eva, you're on mute, my love.
No, I was just talking to a therapist. I think that's what you heard.
Okay, cool.
Must have on mute.
We didn't hear anything. I just saw your mouth moving and I thought you were talking back to Sarah, so it's fine.
No,
it's fine.
sorry. No,
Sarah, just as for a time check for you, it's 10:56.
That's cool. And yes, I thought we'd be doing more case discussion, but yeah, is there anything else anyone would like to bring?
Sarah, can I just ask, as a non-trained aromatherapist, how would you explain to a client how it works? Because like Tara, I have increased my results. I don't know what percentage, but they're definitely like increased. Just by using that oil, I notice a difference with my long-term clients.
Amazing.
But I don't quite know how to say to them, it's not just me, I've got a little helping friend in the oil. How can I say how an essential oil works?
You can say that these are the natural chemicals that plants produce for their healing and their hormone balance, and there's been a fair amount of research done as to their effects on humans, and that each oil contains lots and lots of different chemicals with lots of different effects, and when you combine them all together, the whole is much greater than the sum of its parts. So it's really complex, and that
but it sinks into the blood system through the skin.
Oh right, yeah. So yeah, basically you've got the capillaries in the dermis, haven't you? So
yeah,
admittedly a very small amount of it is actually going to get in that way, but the client will be inhaling it as well.
Yeah.
So they're inhaling it, and that's going into the blood in their lungs and through the skin. You have the physical effects, you have the pharmacological, the effects on their chemistry, and you have the psychological effects of the oils.
Yeah.
The sort of three types of effects. So what is it doing to the actual balance of chemicals in their body? What is it doing to them emotionally? Which is why the smell of something, because of that link between the olfactory pathway and the limbic system, the amygdala, the hippocampus.
Yeah.
If their abusive grandmother used to use lavender, then that's going to be the worst possible thing, and you're going to get a fight and flight response. So even though lavender is a hypotensive, for that client, it's going to be a hypertensive, isn't it? Because of that sympathetic.
Yeah.
So it's more complex than just like drugs, where it's one or two substances and a particular effect. So it's quite hard to quantify. And you can tell them that that a colleague of yours who is a trained aromatherapist and a sports remedial, I do sports remedial myofascial. I know what I'm doing in terms of the body and in terms of the oils, and I've put the two together.
I usually say it's just magic oil. and
It's
that just
magic
sort
oil.
of covers it.
It is.
In every sense, it's magic oil.
And the reason it got that name actually was because of a lady with arthritis, and I was using it on her knees, and I love that oil. It's magic, and I thought, so that's why it was called that.
And I do a lot of energy work as well, and I can feel almost their system just calming, and their auric field, just like any patches, it all just sort of just flows better, much better.
Yeah, amazing.
Mm-hmm.
Great. Well, thank you. I mean, it's lovely to hear. Obviously, I see it with my clients. It's lovely to hear you guys coming back with all the success stories, because it's lovely to be doing a bit of good remotely, and they can be doing this for themselves in their homes, or you can talk them through on a Zoom call, and they can still pay you to give them a self massage, or they could just buy the oils off you at the retail prices. Which are incidentally, you're buying them normally at $9.97 or $19.97 for the big ones, or $10.47 for the Scar and the Mayo. But yeah, basically, it's you add £3. It's £3 for the small ones, or £6 for the big ones to your client prices.
Sarah, have you
$12.97.
ever thought about doing larger refills with non-pump? Have you been asked for that?
No, but that's a really good idea. I like that idea. I like that idea a lot.
Because I would quite happily buy a litre at a time.
Great, thank you.
Can I just say, be going through, if something's quite good, we use sort of muscle oil before as well. So if you use a lot, we've 6-7 people here, so it's a litre or 2 or 5. And then you rather refill than having all these bottles, and that's why I didn't. Why I stopped using what I used before, because one of the problems was I couldn't get big containers, and I was actually thinking of asking if you could do bigger ones as well. So it's a great question, Laura. And then just to have the little one, like manageable ones for clients as well, but because it was just too much, that clients then had to buy to apply themselves, and that just goes off. I mean, you need very little. I think maybe even smaller than what even half of that would probably be enough for many clients, I think. Just to make sure it doesn't go off.
I mean, this is the feedback I've had so far, is that the bottles are the right size, so it doesn't go off. And but absolutely, that could be arranged for you. Give me some notice, but that could be done. I mean, at the moment, I've got a batch that is I am selling off now, so I mean that offer remains for today. Moving forward, that is definitely something I'd consider doing. Absolutely. If you want it, but I would probably take an individual order for that, because most people just don't want that quantity. But if you do, brilliant.
Can do that. That'd be great. Yeah.
I could do that. That wouldn't be a problem at all.
Thank you.
Fantastic. Is there
Sarah,
anything? Hello.
Yeah, hi, this is Nadia here. So I just want to ask, in terms of the nerve magic, because obviously we've kind of looked at some of the physical symptoms, but would you also recommend it for people with sort of like non-visible symptoms, such as emotional, or people who are maybe suffering from trauma and stuff like that? Do you think the nerve magic would be a good one for them?
Yeah, and I've equally heard that the rescue magic has helped people with that kind of trauma as well. But to be honest, they all have an emotional component to them. The Scar's quite antidepressant. The nerve is certainly very uplifting and stimulant and antidepressant. It's a bit of a kick up the bum for the nervous system on all levels, and the muscles very calming and soothing. And the rescue is soothing in a slightly more perhaps nurturing way, that I found people. They found it as useful for an emotional shock as for a physical one.
Okay, excellent.
And I don't mean the actual medical shock. I just mean that, you know, the immediate, the acute trauma. Yeah.
Yeah, absolutely. That's what I understood it as anyway. Fantastic. No, that's really good to know. So I suppose it's then really finding out which one actually works with which client, basically.
Yeah, if you think of what they're presenting with physically to begin with, but yeah, on an emotional level, I guess it's about whether they need to be calmed down or kicked up the backside, with love, and also seeing which one if you're really not sure, just let them smell them, and like which one do they really,
which they're drawn to. Fantastic, that's good. Thank you.
Welcome. Any other questions? Does everybody now have a better idea of what they would use and when?
Yes, I do.
Great. That's what we wanted. Fantastic.
And, are you gonna send the presentation as well, or?
Yeah, that would be good if you could.
Another job for you, Catherine.
That'd be great, because if I show that to my therapists, then they're much, I want them to be informed when they use the oils. That's the other thing. Because if not, they just go like, yeah, it's just something that smells nice, and they're back in the morning without any background.
Sarah, are you happy for me to forward the presentation on as a PDF after the meeting?
That'd be good, and perhaps do a wee transfer to a link to the recording as well for those that didn't.
I will.
Would anyone who was actually here today like the recording as well?
Yeah.
Yes, please. That would be great.
I'd send it to everybody who was on our original list, because not everybody's made it. So yeah, that'd be amazing. Only 50%. So yeah, that'd be great, Catherine.
We did have a couple of people that just couldn't access it, and they've sent their apologies. I don't know why, because obviously we have people here that have accessed it easily. But I have in the background spoken to them and said that we will forward the recording on. So and they're happy with that, so that's fine.
Excellent, that's amazing. I think the last thing then, if there's nothing from anyone else, is there anything from anywhere else? No. In that case, I just like, obviously there's I've got 2 plugs. Have we got time for 2 plugs, folks? Hope we have. Okay.
The silence says yes to me.
The silence says yeah, I think so. Okay, so the first plug is that wonderful offer for the products. I'm still happy to keep that open today, and we've got your addresses. If there's anything else you'd like to order, basically £5 for a small bottle, £10 for a big one, write in the chat box what you want. Catherine, you can make a copy of the chat of the who wanted what, if you would please. So yeah, if you want anything, last orders, folks, for this amazing festively mad offer, and we will get those out, and hopefully the Royal Mail will get them to you before Christmas, although I can't bank on it at this rate. But yeah, that'd be amazing. So please write in the chat box what you want and how many. Because I put the prices down a few months ago, and then we're on half, so really that's another good offer. I'll let you do that. Is there stuff coming into the chat box, Catherine, at this point?
Not at the moment, but there are. I think some people are typing. So
okay, brilliant. So I'll let you carry. I'll just give you a minute to carry on doing that first. My next plug is that cleaning and dealing with spilt oils is one of these banes of a therapist's life, and we like to be nice to the planet. I've recently started doing Norwex, which is a super sexy system of cleaning products, mainly microfiber cloths and a few very natural chemical products. And yeah, it reduces your cleaning time by 75%. So if you hate cleaning and you do a lot of it, and you'd like to do the same amount but in less time and with nicer chemicals, which are better for your home, and don't leave nasty smells in the treatment room, I've got a launch party next Tuesday evening at 8 o'clock, and then an overspill one next Friday on the 15th and 18th at 8 p.m. So if you want to find out more about eco-friendly, very sexy cleaning, that can even deal with oils. So some of these bottles of Nerve Magic you guys have received, what you didn't know won't hurt you. But there was a bit of an accident in transit, and we didn't know until we'd opened them that something somewhere had leaked, and it was a bit weird because we couldn't identify. So Matt and I were peeling off the labels, scrubbing up with the amazing silver and microfiber EnviroCloth and their natural degreaser, which smells like limes. We were scrubbing those bottles and putting on new labels so that they could still be sold. Because I'd sent a couple, not quite realizing how bad they were, and got some feedback that wasn't so good. So yeah, Norwex can deal with even massive oil slicks that you get in aromatherapy and massage from time to time, as well as around your home. I can now clean my sink and draining board in 2 minutes, and it used to take me at least 10. So if that's something you guys would like, please put your name in the chat box and whether you want to come on Tuesday the 15th, Tuesday or Friday, and I will email you or Catherine will, one of us will email you the appropriate link to come and join me to find out more about that.
I can put back the link in the email, Sarah, with the just as a, you know, an addition with the slides.
That'd be great. But yeah, okay, yeah, we can do that. But how does that sound to everybody?
Fantastic.
Sexy cleaning? Awesome. Great.
But you have to put a positive spin on it.
Well, okay, well, cleaning isn't sexy, but having more time to do other things that are more fun is very sexy, right?
Yes.
Yeah.
Okay. Are we, Catherine, I'm sure you've got the chat there. Are we all done, folks? Shall I wrap up then?
Yeah, thank you.
Okay. Thank you so much for joining, and it's lovely that you're getting amazing results with your clients. It's music to my ears, and yeah, keep in touch, guys, because you're all wonderful customers, and you know, any questions at any point. I've got a client